Today we are at Skin Sanctum Hyderabad and we are interviewing one of my favorite people from the city, Dr. Karthini Baba. She's a dermatologist specializing in aesthetic medicine. This session is about the wellness and preventive care of your feet. Thank you so much for doing this for us, Doctor. Could we start with 3 tips that you could give us for taking care of our feet?
Thank you for having me, Vishka, first. Well, we all know our feet is something that takes a lot of pressure all throughout the day. That's the main area where the complete body weight comes on the feet. So taking the basic care of our feet is the paramount for the well-being of our body. So I would start with first moisturize. Don't leave your feet unattended, dry, cracks. It can lead to a lot of bacterial or fungal infections. Make sure the nails are clipped on time. Make sure there are no ingrowths, and the most important is your footwear. Make sure you're using a very comfortable cushioned footwear.
Could you tell us about some of your favorite products that you use on the feet?
Well, to begin with, moisturizer, Venusia Max Cream is one of my favorite. The Bioderma Balm is very nice, thick, full of butters and ceramides. That's very good. Now, somebody who has cracks, dry feet, a little flaky feet, they can use products with urea, lactic acid, something called Zarina or Moisturex. A little step ahead of that, somebody who really has dry feet, they can scrub a little bit, wear the cream with urea, lactic acid, seal it with like a socks, at least alternate days. You'll see that your feet will be nice and supple in the next 4 months.
Could you please tell us how often do you think one should get a pedicure?
Well, to be honest, pedicures are not really a must unless you're not scrubbing once in a week. So if you're really not doing it at least once a month, but if you're getting your pedicure done, make sure that your pedicurist is not really cutting off the cuticles, going really deep, because that will again expose you to bacterial or fungal infections. But if you're scrubbing at least once in a week with a basic pumic stone, soaking it a little bit in either your regular salt or Epsom salt, not more than 10 minutes, it's more than enough.
Your take on gel nails?
Absolute no. I'll tell you why. Because gel nails cause a lot of damage to the nails. They thin out the nails. So first, to apply the gel nails, they really buff and remove 2-3 layers of your nails. And then the gel itself is damaging to your nails, and then you have to put your fingers in the UV chamber, which is again causing tanning. So one application of gel nails damages your nails for good 2 to 3 months. They take 2 to 3 months to recover from a single application of gel nails. So it's a big no. Unless there is an event you want your nails to last for good 1 month, once in a while it's okay. Otherwise, not regularly.
But normal nail polish is fine?
It's fine, but again, not regularly, because sometimes if there is any kind of infection, again you tend to miss out on that infection because there's nail polish always covering the nail. So again, once in a month or once in 2 months, that's okay.
Could you talk about the top 2 or 3 conditions which you think absolutely need a dermatologist and people should not try to treat themselves at home or read up online?
Let's begin with the most common, which are the corns and calluses. If you have callus, it's still okay, but corn, don't try to meddle with it. Second is your fungal infection. A lot of people don't even realize that they have fungal infection on their toenails. You can see a nice white patch. If there is a nice white patch, it could be fungal infection, or if there is a green-blue patch also, it could be fungal infection, or there is some kind of white patch in between the toe spaces, even that's fungal infection. And the last one is if there is tenderness over the bed of the nails. It is not something that you've just got it overnight. It's a very bad bacterial infection. It can increase and give you severe pain. So these 3-4 conditions, don't try to treat it at home. Please come down, show it to your dermatologist and get it treated.
Very often the people in the beauty parlors offer to remove the corns. Is that something that we should go ahead and do?
Not at all. See, corns is not something that is as simple as it looks on the surface. It's a small surgical procedure. We cannot do it at the beauty parlor. Keeping that aside, doing this procedure under a septic condition is very important, so that your corn does not get a secondary infection. So I do not advise it to get it done at a beauty parlor.
Could you throw some more light as to what causes the corn and if there are ways to prevent it? Because most people who come to us to buy shoes tend to complain of corns?
Let's understand the basics of it. The corn calluses is caused for one major reason, being not wearing a very good comfortable footwear which is balancing out the weight equally all throughout your foot. If that's not happening, there's a pressure that is formed on a particular area, and the corns and the calluses tend to form over that pressure area. So one thing that everybody should really keep in mind is, again, footwear. A very good comfortable footwear, and you guys are really good at making very good comfortable footwear.
So, do you think the material of the footwear or the heel of the footwear is something that could cause the corn?
Material of the footwear can cause something called eczema or dermatitis, not really corn or calluses. But yes, the height of the footwear and the cushioning of the footwear is something that will determine the corn or the callus.
So one tip that I have for you guys from all my years of working with footwear is it's a good idea to wear different kind of footwear every day. For example, when you wear something with a toe ring, the complete pressure is on these 3 points of your sole. Whereas when you're wearing something that is a V-strap, the pressure is here as well as here. When you're wearing something that has grip just on top, the pressure is on the front part. So because you're wearing different shoes every day, you're rotating the pressure in your feet and sole and avoiding the wear and tear of one particular part of your sole.
I would like to add another point here. So happy to see this, because I see that this material is not used on the inner surface as well. We see a lot of footwear having the same material on the surface in the inner surface as well, giving rise to eczemas and dermatitis. I also see a nice breathable material here which will make sure that all the sweat is absorbed and there's nice prevention of bacterial or fungal infection that can happen with very tight footwears.
Thank you so much for doing this session with us, Doctor. Most people ignore their feet and don't realize it's so important. But I'm sure this session is going to throw a lot of light on the topic. So thank you.
Thank you for having me, and I hope this session helps a lot of people with foot issues.